Hi, here are a few exercises that I like to share with my patients who are experiencing pelvic pain. So let's get right into it. However, remember, this is for informational purposes only. It does not substitute actual physical therapy here at Dr. D's Physical Therapy Center. So one exercise I often give out on the first visit is diaphragmatic breathing. The rationale behind that exercise is that the diaphragm and the pelvic floor work together like a mirror. So when you utilize your diaphragm to take a nice big inhale, your pelvic floor muscles will automatically go into a relaxed or lengthened state. And a lot of patients that have pelvic pain, their pelvic floor muscles are in a consistently contracted state or a shortened state. Okay, so to do diaphragmatic breathing, you're going to basically make all of your air go into the belly, and you're going to allow your stomach to inflate really big like a beach ball. Go ahead, try it with me. So I'm breathing in through my nose and then out through my mouth like I'm blowing out candles. Let's try at least 5 of these together. I believe that was 5. The next exercise is happy baby pose. Happy baby pose, again, is a way to not only stretch the pelvic floor muscles, but now you're going to get nice elongation of those adductor or inner thigh muscles, and you're going to get good external rotation of the hips, which is important also for good pelvic floor function, and again, to improve relaxation of the pelvic floor muscles. I often like to incorporate the belly breathing or diaphragmatic breathing with happy baby. So you're going to lie on your back. You're going to bring both knees up and out to the side. You're going to take your hands inside the crook of the knees, and then you're just going to simply hold this pose. Often I like to do 10 diaphragmatic breaths in this position. Let's go ahead and give that a try. I think we're about halfway there. Okay, go ahead and gently bring your knees together. Place your feet on the floor. We're going to bring everything over to the side into like a fetal position. Come up onto your hands and knees. Great. Give a moment for the blood to not rush into your brain so that you don't feel dizzy. The next thing we're going to do, we're going to go ahead and get into child's pose. Again, child's pose is going to offer a great opportunity to improve the mobility of the hips, but also lengthen the pelvic floor muscles. And we can get some nice, good diaphragmatic or belly breaths in this position too. Let's give it a try, huh? All right, so I'm gonna get onto all fours initially. Your knees are gonna be about the width of a yoga mat, or you can use a beach towel. Bring the big toes together, and then you're gonna sit back onto your heels. Come up a little bit, there we go. Sit back onto the heels. Stretch the arms forward and just hang out here. Again, we can do 10 diaphragmatic breaths. This should be number 6. Okay, I think that was about 10 diaphragmatic breaths in that position. Again, these are just a few exercises that you can use to incorporate in your daily routine. It's about 6 minutes. I was going for 5, but here we are because there's a lot of talking involved and explaining. But you can always try doing these exercises for like 5 minutes. Take 10 diaphragmatic breaths in each position. If the diaphragmatic breathing is too much for you, just breathe. Just simply breathe and try these exercises to help calm down your nervous system, but also relax your pelvic floor muscles.